Hi, my name is Ashraf,
And my name is Nadia.
and we are a group of Republic Polytechnic students from School of Technology for the Arts, Media and Design. And we are collaborating with School of Applied Science to conduct a research focusing more on sustainable pharmacy waste disposal.
Hello everyone, I'm Deborah, a pharmacist, and today we'll be looking through some of the answers that the public got back to us about how they manage their medicines.
And today we're going around Pugol and Ulangs to find out from more people about how they manage their medicines.
Come and join us!
So at home, uncle, do you have a lot of medicine?
A lot.
Banyak ubat tahu ambil.
Berapa banyak ubat yang ada kat rumah?
Tujuh macam.
So how do you differentiate between which medicine is for what?
My wife arranged for me.
I see. Okay,
So every
sweet.
medicine, my wife already used to it because already 10 years over, I taking this all the medicine.
So I'm gonna show you a medicine and I need help for you to identify the name of this medication.
Is the name of the medication omeprazole?
I don't really can read it.
Okay.
Nenek tak tahu.
Nenek tak tahu. Lepas tu macam mana nenek agak-agak tengok mana satu ubat ni?
Mana doktor ajar tu yang nenek buat.
Because it's like on the packaging, right? Then like it's like it says like the capsule, then like
Okay, so the name of the medicine is omeprazole, and the strength is 20 mg. The strength is usually indicated next to the drug name, and the strength of the medicine refers to the amount of active ingredient inside the medicine. It is typically quantified as grams, micrograms or milligrams, and different strength of the medicine may exist. So in order to know what's the correct dose to take, you need to know the strength of the medicine.
weird name beside it that I don't recognize, so I just assume it's
Yes, correct.
How should medicines be stored to ensure that they can last until the expiry date?
it should be stored in like somewhere cool, right? Like lower temperature and like dry.
Refrigerated, maybe for like cough syrup, open bottles medicine.
My mom would store them in the fridge, but I think I would store them in a more warm place, like the cabinets. Because I have a lot of cabinets at home.
Nenek tak simpan mana-mana. Nenek tahu dah satu beg aja untuk nenek makan. Yang lain nenek simpan lah.
Any specific places in mind?
Do you see your wife ever like store in like the refrigerator or like at your cabinet?
No.
So she just put at the table, is it?
Yeah.
I see. Okay.
Fridge?
So to ensure that your medicines are stored until expiry, they should be stored in a cool, dry place, such as the living room or the drawer, and away from reach of children. It should also be stored away from heat or light, including warm places like near the stove, near the oven, or even in the car glove area, because heat and light can damage your medicines. And also look out for special labels such as the refrigerate label, and this will tell you that the medicine is to be refrigerated. So if the medicine needs to be refrigerated, remember, don't freeze it, just keep it in the normal fridge compartment. And it's also recommended to keep the medicines in their original packaging to prevent any damage. If you pack your medicines in pill boxes, just take note, certain kinds of special medicines such as the oral disposable medicine is not suitable to be taken out of their packaging in order to prevent any damage to the medicine.
How do you safely throw away your medicine?
Tak pernah tak habis. Dah habis semua. 4 bulan dah habis.
Okay.
If we got a lot of medicine, then we will check. When I'm going to collect the medicine, we'll write down the name for them. This one will be extra, so
Okay.
I don't take anymore. That will save my money and I don't waste it.
Okay, before I throw away my medicines, I will peel off the label, especially when there's my name, all the information, personal information on the medicine. Then I throw it away.
Like in a plastic bag wrapped up, like in the chute thing outside the DGP.
So just like in the trash or okay.
Okay, so most of the medicines can be thrown in the dustbin together with general waste. The main thing is to remove away your personal identifiers such as your name or the IC number. However, some medicines such as the antibiotics, anti-cancer medicines, or medicines that can be abused such as morphine or fentanyl should be returned to the pharmacy for proper disposal. And if the medicine is a patch, remember to fold it into half with the sticky sides together. This will prevent accidental pickup. for use by people, children, or even pets. So if you're unsure of what medicines class it belongs to, check with your pharmacist.
What do you think are some of the medicines that can be stored in the fridge?
I think it's Panadol and cold and flu medicine.
Usually the eye medicine, I forgot what the name is.
IMO.
Yes, it's something like IMO, but it's basically for the eyes.
So to keep your medicines properly, always read your label for any special storage instructions. Some medicines are to be stored in the fridge. Some examples include unopened insulin vials, some antibiotic suspensions after you add water to it, certain eye drops, ear drops, and certain oral medicines. But always ask your pharmacist or the technicians at the counter if you're unsure of how to store it.
How do you store medicine when traveling?
Where do I keep it? I mean, I think that I'm supposed to keep it with me all the time since I'm like me.
Because personally, I don't eat medicine because I don't know how to swallow. So I will take the syrup one. Yeah. So, but for my parents, most of the medicine he will just bring the one in the packet. But then I know that some people actually use the divider, box have like Monday, Tuesday, Wednesday. Yeah, then they just put it all in a box.
Okay, when traveling, remember to keep your medicines in their original labelled container in your hand carry luggage. Ensure that they are properly labelled with your full name, the name of the medicine, and the dose needed.
Do you agree with this statement? I can stop my long-term medicines when I feel better. Example like blood pressure medicines or diabetes medicines.
I feel like you still need to eat even if you are getting better because you are always prone to getting back sick. So I feel like only when you're diagnosed to free or cure, then you can stop. But if you are still in the process, I feel like you still need to eat because it is better for your health. Yeah.
Correct.
Okay, remember, do not stop or change your long-term medicines without consulting a healthcare professional such as your doctor or your pharmacist, because a sudden stop of certain medicines can cause rebound side effects or worsening of symptoms. So for instance, some medicines require lowering of doses over a few weeks before stopping them. And if you stop certain high blood pressure tablets suddenly, it may cause the blood pressure to rise up to a dangerous level. So always speak to a healthcare professional if you're unsure about your medication.
Do you think expired medicines are safe to take?
If my mom was here, she would say it was.
I don't think it is safe because some medicine there may be bacterial growth, and also I don't see it is any more effective if you are using it.
Okay, so it's not safe to consume expired medicine because it may not be effective and may be harmful to you. And if the expiration date on the tablet that you see only has the month and the year, the intended expiry date will be until the last day of the month, not the first day. Do note that some medicines have shorter expiry upon opening. Some examples include eye drop. Certain eye drops will expire 1 month after opening. So likewise, if you're unsure of the expiry date, check in with your pharmacist. Okay, we have come to the end of this short sharing. I hope everyone has learned how to manage medicines properly so that we can be on a healthier planet. Know how to manage your medicines, ensure that you don't have so much wasted medicines at home, and collect what you need. The earth will be a better place.